Hello, everyone, and welcome back to The Small Project, the podcast of the School of Dentistry at IMU University. My name is Shahed, and I'll be your host for today. Thank you for joining us. So, with us in the studio today is the Dean of Dalhousie University, Dr. Ben Davis.
Hi, how are you?
I'm great. It's a pleasure to have you here with us today.
It's wonderful to be back in KL, and I really enjoy coming back to IMU every other year now. This would be my 8th visit to Kuala Lumpur.
You're almost a seasoned traveler here.
Almost a seasoned traveler. I have to get outside of KL, but I love IMU, and it is a real pleasure to be back.
Well, that's lovely to hear. So, as you all may or may not know, here in our IMU Bachelor of Dental Surgery program, we have 6 partner school options, and one of them is Dalhousie University. So, let's dive in today and answer any and all questions you all might have about the dental program at Dalhousie. So, would you mind providing us an overview of your dental program's curriculum and maybe some of its unique features?
Sure. I'll back up just for 1 second. A bit about myself. So I started at Dalhousie in 1997. I actually did my undergrad dental degree at the University of Western Ontario, and then I did my surgery at the University of Toronto. So I've been at Dalhousie now for 27 years, and by far it's the best, dental school that I've worked at in Canada. There are only 10 dental schools in Canada. But I'm extremely proud to be affiliated with Dalhousie because I do think it's very special. In terms of what makes us unique, I would say we have small classes. Our first year class is only 40 people, and then our second, third, and fourth year classes are only 48 people. We have a lot of faculty, so the faculty to student ratio is exceptional or very, very good. And I think our faculty are extremely caring, and they really take an interest in our students and want to see them succeed. Our curriculum is revised on a regular basis by our Dean of Academics, Dr. Sachin Seth, who's here with me. And I think one of the gems of our curriculum is what we call the small group practice. And that's where in our, the senior students year, they're divided into 4 groups, and they are partnered also with dental hygiene students who, again, are also attend Dalhousie University. And together they work collaboratively to provide patient care to a family of patients. And it's more about, again, comprehensive patient care than it is about, making sure that you've done X number of fillings and X number of bridges or crowns. So it truly is about teaching how you're going to practice when you graduate.
Wow, if I had the option to go to Dalhousie now, I would. I also, from what I've heard, is your degree is only 4 years compared to here in Malaysia where it's 5 years. So why is that?
Yeah, well, there's a good reason for that. In Canada, it's very competitive to get into dental school. So pretty well all of our students who are admitted into the first year have already done a university degree. So they've already done a Bachelor of Sciences or some other type of degree. In fact, many actually go on and do a master's before they're actually admitted. So the average age of probably the first year dental student is probably quite a bit older than it is at IMU. It's probably in Canada anyways around 23 or 24 years old.
I see. Well, that's good to know. So what kind of dental technology or innovative techniques does your school incorporate into its curriculum and in clinics?
Yeah, so a couple of interesting things. I think from a kind of classroom perspective, one of the features we have is what we call the Vital Source bookshelf. And that's, again, where on your computer you have all your textbooks downloaded every year, and that's part of your tuition. So all of your textbooks are included. You bring those to class. You can highlight in them. The profs will typically refer to pages in your textbooks. So it's just very seamlessly integrated into the lecture. In terms of clinic, we're fully digital. So we have a large number of intraoral scanners. We have cone beam CTs. We have several of them. We get students, again, learning about digital workflows very early on. and how to use digital technology to scan preps and have, again, on-site CAD/CAM technology, be able to mill crowns and bridges. We do have an on-site dental lab, so again, it's one way that we can seamlessly work together. So those are, again, a couple of the innovative parts to our curriculum that I think set us apart.
Well, that will really definitely prepare the students for when they work outside after graduation.
Yeah.
Especially with the digital dentistry being everywhere nowadays.
Exactly. Yep.
So what sets your program apart from other dental schools in terms of preparing the students for residency or even dental practice?
Yeah, I think, again, there's a heavy clinic focus, so we want students to get as much experience as possible. We also focus on outreach and community engagement and giving back to the community. So our outreach clinics, of which there are about 10, are foundational to our students' experience. So I think our students rather come out and graduate from Dal knowing and wanting to, again, be involved in providing outreach to people that are less, fortunate than themselves or more vulnerable. So I think that prepares us very well for community service. I think, again, the fact that we have such a high volume of patients and the students are graduating with so many procedures under their belt that they're just very well prepared for practice.
Right, and in Dalhousie, after you graduate, you can work immediately. From what I've heard, there's no like residency or housemanship that needs to be done.
Yeah, so I would say the majority of our students will go directly into private practice.
Right.
Now, they will often associate for somebody, so they won't have to buy a practice themselves. But there's probably about 20 to 25% of our students who will go on to do postgraduate work. They'll either do a general practice residency or they'll go directly into a dental specialty. In North America, most dental specialties are highly competitive. So again, most students will do a general practice residency initially and then apply to a dental specialty. And interestingly, we have 2 of our grads from IMU who are actually both in oral and maxillofacial surgery residency programs in North America.
I see.
Yeah.
Well, that's very cool. So, what is the student to faculty ratio in Dalhousie, and how accessible are the professors and clinical instructors to the students?
Yeah, well, we're there for the students. So we do have about 150 part-time and full-time clinic instructors. About 48 of those are, again, full-time, so they're usually always on site. But then we have a lot of part-time instructors that come through the clinics as well. I'd say the faculty-to-student ratio is probably about 6 to 8, depending upon the clinic block that you're in. So, good clinic ratios. We have specialists on the floor all the time. So again, we do have, even in the small group practice models, specialists that can help with, again, challenging cases. But a lot of the group practice is taught by, again, just very experienced general dentists.
Wow, that is a very close ratio.
Yeah, it's pretty good.
Mm-hmm.
Yep.
So, coming from IMU students, what qualities or skills do you expect the students here to have when they begin at your program over at Dalhousie?
Well, our experience, and this is the 10th year now that we've been involved with IMU, our experience has been that the IMU students come very well prepared. Certainly the foundational knowledge that's required to do clinical care is not an issue. I mean, you're very well prepared here. There is a bridging program, so again, any kind of small gaps in your knowledge are usually dealt with before, again, you start full-time in second year. And second year, we recognize this also, it's still a developing year for our students. So we don't expect you to be doing, major comprehensive care in second year. But again, my feeling and my experiences has been that the IMU students that we have accepted and seen at Dalhousie have been very well prepared.
Well, that's good to know. Hopefully our own students can stop worrying so
much. Yeah, they shouldn't worry at all. Yeah.
That's good. That's great to hear. So then, how important are soft skills such as communication and teamwork in your dental program, and how do you foster their development?
Yeah, great question. I think the research demonstrates that those metacognitive skills and those emotional intelligence skills like communication, empathy, professionalism, those are really, really important to lifelong, successful practice. So we recognize that they're important. We try to foster and develop those qualities throughout. We certainly, have parts of courses where, again, the importance of communication, record keeping, how to have difficult conversations when things haven't gone right, rather with patients, those are part of the curriculum. Unfortunately, some of those skills, though, some people have them more innately than others. So it's difficult to always ensure that everybody has the same level of those soft skills. But we certainly try our best to make sure that people are graduating with good enough soft skills that they're going to be successful in their practice.
That's good. That's great to hear as well. So then, what advice would you give to new students to help them succeed in your program over at Dalhousie?
Yeah, I think whatever program you choose, wherever you go, whether you stay at IMU or again finish up at one of the partner dental schools, dentistry is a commitment. It's hard work, long hours, as you know, a lot of exams, a lot of tests, a lot of stress. So I think it's really important for students to take care of themselves while they're going through the program, get enough sleep, try to actually go out and get some exercise, eat well, and just take care of yourself and remember that, you've got a 30-year career ahead of you, so you don't have to actually get everything right, the first time. So take care of yourself, of course, study hard, learn from your mistakes. I think one of the strengths of our program also is that we celebrate mistakes. Somebody shouldn't be penalized for a mistake. You should learn from it. So I think that's really important. We tend to be very hard on ourselves as dentists. We, are meticulous. We are perfectionists. So when things don't go well, we sometimes are very hard on ourselves. So we try to actually, kind of get students to be, reflective on mistakes and learn from mistakes, but not to be hard on themselves. So, that's probably my advice is, take care of yourself. You can't actually do well if you're not getting enough sleep, if you're not eating well, if you're not, just getting away from the profession once in a while for some downtime. And when something does go wrong, seek out friends, seek out colleagues, seek out staff and faculty, and talk about, kind of what's bothering you, talk about the mistake that was made and how to make sure it doesn't happen again.
Did you hear that, guys? That's for all of you. Also me, I really need to listen to that and take that into consideration. Yeah. It's very, very good advice.
Yep.
So that will conclude our interview for today. Thank you so much for joining us. Hopefully this episode will help all of our students decide what partner program they want to go into. Hopefully they choose Dalhousie.
Yeah, and again, I'm always happy to answer emails. So if somebody wants to email me, my email is easy. It's bdavis@dal.ca. Always happy to take an email and again, just reply to any questions.
Thank you. Thank you so much.
You're very welcome.
So that would be all for today's episode. Don't forget to follow us on social media at The Small Project IMU on Instagram and The Small Project on Spotify and YouTube so you don't miss out our next episode. See you next time. Bye.